figure 11-1. Because I think what this figure does, we'll put up them slides, and as the slide says, emphasizes the role of efforts to address societal determinants of health by implementing effective public health interventions. By effective public health interventions, generally what the authors of your book are talking about is this whole unequal society thing. Effective public health interventions for mental health care, physical health care, involve making it more equal, making it more available to more Americans. So when we talk about 48 million Americans being uninsured, their argument would be make it a greater safety net. There's not a whole lot of discussion of the Affordable Care Act in this book. I'm sure in later editions they're going to spend a lot more time talking about the Affordable Care Act. But let's understand that what we call the Obamacare, the Affordable Care Act, I'm not telling you, look, do we know, when was the Obamacare Act passed into law? How long ago?
A couple years ago.
It's a couple years ago.
2014.
Is it working? Is it working? Is it going to work? Is it not going to work? What's going to happen?
Can't tell yet.
It's not doing well.
Not doing well?
A lot of the exchanges went up.
Some of the exchanges, which are the sort of the actual repositories of healthcare, right? These exchanges that provide healthcare for Americans, some of them are just going out of business. Now, I think some of the early numbers are showing us more low-income people are becoming insured. I mean, some of the data is starting to come in. There's more people, low-income Americans that previously didn't have healthcare who are now insured. I mean, that's just kind of a reality. But we also know that what's happening to premiums. Yeah, people's premiums are getting jacked up, right? Not everyone's, but if you're a higher income American, your insurance premiums are generally getting jacked up. I know mine are, right? So then this puts the onus back on individuals. The authors of your book are trying to make the case that in a more fair society, right? In a more fair society, those with higher incomes, those with more resources, should be willing to pay higher premiums. Because if they pay higher premiums, it assures more of us as a society. So, if I'm paying more in premiums to insure more low-income Americans, am I supposed to simply do that out of the kindness of my heart? Am I supposed to do that out of the kindness of my heart? What compels me to do that? I mean, government compels me. Let's just put government aside. Why should I do it? Is there any reason for me to pay more premiums so low-income Americans can be insured, have health care?
If you don't, then you have to pay a penalty at the end of the year.
Right. So the government can penalize me, which they do, right? The government can penalize me if I pull out of the Affordable Care Act. But I'm asking a more ethical question. Do I have any self-interest in paying more for health care?
Depends on what kind of person you are.
Okay, that's a good response. Let's say you're a complete, unethical, degenerate, cheat, and a gambler like me.
No.
Right? Why would I pay more in health care? I don't give a rat's ass about the poor. Get your own health care.
But I mean, it doesn't make you degenerate for not wanting to pay more just because you make more.
But I like being a degenerate. No. All right.
But I'm saying that shouldn't, just because, like, I mean, if you don't feel like that's fair, that doesn't mean that you're degenerate or don't care about people who can't afford it, but it just, I mean, because you make more, you have to pay more.
That's absolutely correct. I mean, look, I've told you, I'm not picking sides here. There's very strong arguments to be said for people that argue, look, why are you taking my money to insure someone that should be insuring themselves? You know, we're all responsible. Can't we all be responsible and like go get jobs, right? So that's one side of the argument. Another side of the argument is just simply a liberal progressive idea that we're all in this together, right? We're all kind of in this together. The other argument from the liberal progressive side is, hey, we're bailing out corporations and banks at the tune of billions, right? So why can't we like help low-income Americans with health care? But the other argument, I think you alluded to it in a tangential way, Colton, when you said emergency rooms. Part of the economic argument is simply this. You're already paying more for health care through the back door, right? Because what ends up happening in the United States, and I'm sure there are some people that just die on the street because they don't have health care. I'm confident in a country of 315 million people, somebody's going to die on the street because they don't have health care. It's going to happen, right? But as a general rule, right, we don't have masses of Americans dying because they don't have health care. Even people without health care, without insurance, get their health care. How do they get it?
Go to the ER.
You just go to an emergency room, right? You rush into an emergency room. You're a low-income family. You have no health care. You got a sick kid that wakes up in the middle of the night with blood draining out of his nose, right? You're going to go to an emergency room. And odds are that emergency room is not going to turn you away, okay? Well, all that does is exorbitant. That word. It's going to exponentially bring up the cost of health care versus having a managed system of care, whereby those individuals have some recourse to have daily medical health, physical health, mental health interventions that then keep them from having to use an emergency room at the last minute. You go to an emergency room on a Friday night on the south side of Boston, and you're going to see droves of individuals who are simply there because they don't have access to health care. Yeah, you're going to see your gunshot wounds, and you're going to see car accidents, but you're also going to see lots of people bringing in sick babies, sick kids, because they don't have access to health care. All that, according to this argument, brings up costs. So that this is what the authors of your book are arguing. So that in fact we all do have a vested interest, right? Keeping in mind this unequal society, unwell society, the authors of your book would argue that when it comes to healthcare access and public policy, which is chapter 11, thinking about equal, right? Equal funding, equal availability to access healthcare makes us a more well society. Okay, I think that's going to do it for these two chapters. Again, bigger, broad strokes to close up the book. So I guess this is the last you're going to hear from me, guys. You've got your announcements. You know everything that's going on. We will post the points. Thank you, Kelsey, for helping out. We will be around this week. Oh, there's my final announcement. Keep it rolling. No, class ends on the 8th, August 8th. No late shit. None. Because grades are due right after. So you got to have everything done on the 8th because it's going to take, we only have like a day to grade all your stuff and post your final grades. So it's going to be really difficult for you to be throwing in late work. So make sure you get everything done that you need to get done by the due dates. Everything is due this Friday, right? Things are due by this Friday. Please make sure you get things done so we have time to grade all your material. I've never done an internet class. Hope you enjoyed it. I think already I see that I'm going to see some of you in the fall in the sociology of sport class. So thanks for hanging in there. We'll be around this week if you need anything. Thanks to the graduate students for putting up with me all semester long for the 5 weeks. Thank you, Kelsey, and I'll talk to you guys soon.